Welcome to Health Professional Radio. I'm your host, Neil Howard, and I'm real glad that you could join us again. Going to be speaking this segment with returning guest Dr. Andy Krivoshik. He's joining us here as Oncology Therapeutic Head for Astellas Oncology, and he's going to share his perspective on this year's C3 Prize. Welcome back to Health Professional Radio, Andy.
My pleasure. Happy to be here.
Our listeners who may not be familiar with you, and you were here with us before, I mentioned that you're Oncology Therapeutic Head there for Astellas Oncology. Talk a little bit about your role, a bit about your background, and then let's talk about this year's C3 Prize, the 5th annual C3 Prize, as a matter of fact.
So my group oversees the development of new medicines for patients with very difficult to treat tumors in the oncology space. And we run the gambit from hematologic malignancies to solid tumors, and we're really always building our pipeline and portfolio really to try and address those areas of high unmet need with difficult to treat tumors. And this year's C3 Prize is, I think, an extension of sort of the Astellas overall mission. And if you think about why we do what we do as a company, it's really to try and address everyday challenges facing people impacted by cancer. And the C3 Prize in particular this year is an extension of that mission. No idea is too big or too small, and we're really looking for ideas that will help address not only the needs of the patient or their caregivers or providers or families, but also what's different this year is, I think if you think about the environment, particularly from a cancer patient, it's a little bit different in face of COVID-19. It's also a little bit different with the light of the different health disparities. So one of the challenges for this year is really to see if we can encourage ideas across that broader spectrum. And I encourage your listeners to check out c3prize.com, where we have more information, but I'm happy to talk more about this year's prize.
Well, let's talk about the prize itself. I mean, you're talking about any idea that helps the cancer patients, their caregivers, anybody involved in their care. Also, to address some of the challenges presented by the current COVID-19 pandemic. What does the prize offer to bolster these ideas?
There's a monetary component, a 1 grand prize winner of $100,000 US, and 2 innovation prize winners of $50,000 US each. But along with that comes resources and a network where there's a year-long complimentary membership to Matter, which is a global healthcare startup incubator, as well as a community nexus and corporate innovation accelerator. And one of the things that we've noticed, particularly now that this is the 5th year of the prize, is those connecting of folks and those ideas are probably as important than the actual prize itself. So we're typically looking for ideas that can bring solutions to everyday challenges facing people impacted by cancer, including ideas that can ease the burden of COVID-19 pandemic on cancer patients and their caregivers. And really, again, that speaks to our overall mission at Astellas to really try and address areas of high unmet need with very difficult to treat tumors. And it's not just the patients, it's about the caregivers, it's about the healthcare providers and the system as a whole.
Now, all of the great ideas that the judges have to go through each and every year can't all be prize winners. If someone has submitted an idea before, can they submit again?
Past entries are encouraged, if they were not winners, to resubmit or modify. But I think one of the challenges that you've actually highlighted on is we get so many good ideas. And past winners have included patients who have lived with cancer, caregivers, healthcare providers, patient advocates, entrepreneurs, and more. Those ideas that were actually selected as winners included the range of video games designed to keep patients, pediatric patients, active and informed, specialized child care network that provides stability and normalcy for families, as well as one of its first of its kind, easy to understand digital audio series for patients and their family members with cancer. So I encourage folks, again, to look at the website, c3prize.com. And again, C3, just to reiterate, means changing cancer care. And again, that's really our core mission of what we're trying to do, particularly with this program that's complementary to what we do on the development side as we're bringing new medicines forward.
You know, in its 5th year, let's talk about some of the feedback that you've gotten from people who've benefited from the prize, and maybe from some patients who've benefited from the ideas.
Absolutely. I think one of the key feedbacks we've received is not only has the hearing from, for example, some of our speakers last year at the prize winners and innovation winners to really understand the impact to those patients and the caregivers. In particular, I think one of the ones, given my background as a pediatric oncologist, resonated and I'll never forget, is the Nanny Angel Network, which basically that came out of a need for mothers that were forced to choose between looking after their children and actually going to treatment, or trying to balance those treatment pieces. So hearing those stories of how it's not only just the cancer patient, but the family as a whole, and how some of the changes, particularly with the innovation it can be a complex idea or a simple idea, has really impacted. Another one that resonated very well was, again, from a Be Present Foundation. Mm-hmm. And that, again, was one that was inspired, unfortunately, by a young patient who had leukemia and passed away in 2016. But that network was basically a web-based patient support connection tool that really addressed an unmet need for young adult cancer patients in trying to make sure that they're actually engaged and connected and part of the overall care solution.
No idea is too small, no idea is too big. You don't have to have a medical background, engineering, or anything like that. Just an idea to help change cancer care, right?
Absolutely. And that, I think, is the critical piece, is we partner with folks across the oncology spectrum. We wanted to make sure that we're actually able to call out ideas from the patient side, from the caregiver side, from the academic or technology side. And again, no idea is too big or too small. And again, I think what we're really looking for is those novel ideas that can really be impactful for the patients and for cancer care as they go through that cancer journey.
And these ideas can come from anywhere in the world, right?
That is correct. So worldwide, again, there's no geographic boundaries, and obviously no idea needs to be completely fully flushed out, or if it's an idea, it can go forward, and we want to be helpful and mindful of supporting those innovative ideas.
Let's talk about the application process. What's the timeline that we're looking at for applications to be submitted?
Yeah, so the C3 Prize, again, Changing Cancer Care Prize, is open to all applicants through September 28th. Finalists will be selected in December, and each finalist will participate in a virtual live pitch event in March to determine the prize winners. Additional applicant information, including the application, is available at c3prize.com.
Andy, I appreciate you coming back this year. It's always a pleasure speaking with you, and I'm sure that as things progress in healthcare, especially in cancer care, we'll be speaking again.
My pleasure. And again, as always, happy to connect with you and your listeners.
Great. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest, Dr. Andy Krivoshik. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/HPR Health Professional Radio.